Osteoporosis has haunted women since the dawn of history. Egyptian mummies from 4,000 years ago have been found with a telltale dowager's hump. In the 1830s, the French pathologist Jean-Georges Chrétien Frédéric Martin Lobstein noticed that some patients' bones were riddled with larger than normal holes, and he coined the term osteoporosis to describe such deteriorated human bone. In the 1930s, Fuller Albright couldn't help but ponder what it was about being postmenopausal that made women particularly susceptible to having frail bones. Fortunately, starting in the 1960s, researchers developed more sensitive devices for detecting bone loss, including densitometers, which can determine bone density. In the 18th and 90s, researchers discovered cytokines that influence the development and activity of osteoclasts. Such discovery then led to bisphosphonates, arendronate and risdronate entering the market as anti-osteoporosis drugs.
The most common diseases of the skeletal system are osteoporosis. Osteoporosis is a disease of the bones. It happens when you lose too much bone, make too little bone, or both. As a result, your bone becomes weak and may break from a minor fall or, in severe cases, even from simple actions like sneezing or bumping into furniture. Symptoms. In the early stages of osteoporosis, you probably won't have symptoms. As the disease progresses, you may have symptoms related to weakened bones, including back pain, loss of height and stoop posture, a curved upper back, broken bones, compression fractures in the spine that may cause severe back pain. Treatments. Treatment for osteoporosis may involve lifestyle changes such as diet and exercise, taking calcium and vitamin D, using medicines to strengthen bones in some cases. Scoliosis. Scoliosis is a condition in which the spine bends to the side abnormally. The curvature can be moderate to severe. Any part of the spine can be bent in scoliosis, but the most common regions are the chest area or the lower part of the back. There is no known cause. It is idiopathic. Symptoms. Shoulder may not be of the same height. Head is not centered directly above the pelvis. Ribcage is not symmetrically. A shoulder blade is higher and more prominent than the other. One hip is more prominent than the other. Treatment. The majority of children with scoliosis require no treatment, as the condition resolves on its own as the child grows. Those who do require treatment use a back brace, which is usually effective. A very small number of patients with scoliosis may require surgery. If left untreated, the condition can lead to serious spine, chest, pelvis, heart, and lung damage.
If you feel pain and stiffness in your body or have trouble moving around, you may have arthritis. Most kinds of arthritis cause pain and swelling in your joints. Joints are places where two bones meet, such as your elbow or knee. Over time, a swollen joint can become severely damaged. Some kinds of arthritis can also cause problems in your organs, such as eyes or skin. Types of arthritis include osteoarthritis. Is the most common type of arthritis. It is often related to a gain or to an injury. Types of arthritis include osteoarthritis. Is the most common type of arthritis. It is often related to a gain or to an injury. Autoimmune arthritis happens when your body's immune system attacks healthy cells in your body by mistake. Rheumatoid arthritis is the most common form of this kind of arthritis. Juvenile rheumatoid arthritis is a form of disease that happens in children. Infectious arthritis is an infection that has spread from another part of the body to the joint. Psoriatic arthritis affects people with psoriasis gland in a painful type of arthritis that happens when too much uric acid builds up in the body. It often starts in the big toe. There is no cure for either rheumatoid or osteoarthritis. Treatment options vary depending on the type of arthritis and including physical therapy, lifestyle changes including exercise and weight control, orthopedic bracing, medications. Joint replacement surgery may be required in evolving forms of arthritis. Medication can help reduce inflammation in the joint, which decreases pain. Moreover, by decreasing inflammation, the joint damage may be slowed. Leukemia is a cancer that starts in the blood-forming tissues such as the bone marrow and causes large numbers of abnormal blood cells to be produced and enter the bloodstream. Leukemia is a treatable disease. Most treatments involve chemotherapy, medical radiation therapy, hormone treatments, or bone marrow transplant. The rate of cure depends on the type of leukemia as well as the age of the patient. Children are more likely to be permanently cured than adults. Even when a complete cure is unlikely, most people with a chronic leukemia and many people with an acute leukemia can be successfully treated for years. Sometimes leukemia is the effect of another cancer, known as plastic leukemia, which usually involves the same treatment, although it is usually unsuccessful.
Bone cancer is an uncommon cancer that begins in a bone. It can begin in any bone in the body, but it most commonly affects the long bones of the arms and legs. The term bone cancer doesn't include cancers that begin elsewhere in the body and spread to the bone. Bone cancer also doesn't include blood cell cancer, such as multiple myeloma and leukemia, that begin in the bone marrow. The main types of treatment for bone cancer are surgery, radiation, chemotherapy, and targeted therapy. Bursitis is the inflammation of irritation in the bursa. The bursa is a sac filled with lubricating fluid, located between tissues such as bone, muscle, tendons, and skin that decreases rubbing, friction, and irritation. Bursitis is more often caused by repetitive minor impact on the area or from a sudden, more serious injury. Age also plays a role. Bursitis is more commonly in adults, especially in those over 40 years of age. Bursitis can be treated in a number of ways, including avoiding activities that aggravate a problem, resting the injured area, icing the area the day of the injury, taking over-the-counter anti-inflammatory medicines, and if it doesn't work, see your doctor.
To reduce the risk of having these diseases, you must do weightlifting exercises that strengthen the bones. Ingest enough amounts of calcium and vitamin D. Do not smoke and do not drink alcohol. Avoid medications that cause bone loss. Avoid falling or fall appropriately.